Most people hear the word cancer and immediately feel fear. Fear of the unknown, fear of pain, fear of loss. But oncologists, doctors who specialize in cancer, see something very different. They see not just a diagnosis, but a complex biological process, a wide range of treatment possibilities, and more than ever before in history, real reasons for hope. If there is one thing oncologists want every cancer patient to know, it is this: cancer is not one single disease, and your diagnosis is not your destiny. Cancer statistics are often shocking. Roughly 1 out of every 2 men and 1 out of every 3 women will be diagnosed with cancer at some point in their lifetime. These numbers can feel overwhelming, but they do not tell the full story. They do not explain how cancer develops, why treatments differ so widely, or why outcomes can be so different from one person to another. Understanding what cancer actually is can replace fear with clarity, and clarity gives people power. At its most basic level, cancer is a disease of cells. The human body contains trillions of cells, each with a specific job. These cells grow, divide, repair themselves, and die in a highly regulated and tightly controlled system. This process is guided by genetic instructions and overseen by multiple layers of internal checks and balances. Cancer begins when some cells lose the ability to follow these rules. Instead of stopping when they should, they continue to grow and divide uncontrollably. When these abnormal cells accumulate, they form a mass known as a tumor. Not all tumors are cancerous. Benign tumors grow but do not spread to other parts of the body. Cancer, however, is defined as a malignant tumor. Malignant tumors have the ability to invade nearby tissues and, in some cases, spread to distant organs through the bloodstream or lymphatic system. This process, known as metastasis, is what makes cancer potentially life-threatening. One of the most important things oncologists want patients to understand is that cancer can occur almost anywhere in the body. This is because cells exist everywhere. In women, breast cancer is one of the most common forms. In men, prostate cancer is highly prevalent. In both men and women, lung cancer and colorectal cancer are among the most frequently diagnosed. However, even when 2 people are diagnosed with the same type of cancer, their diseases are often biologically very different. Cancer is deeply individual. A lung tumor in one person may behave completely differently from a lung tumor in another person. These differences can be influenced by genetics, lifestyle, environmental exposures, immune system function, and even the specific mutations inside the cancer cells themselves. This is why oncologists do not treat cancer with a one-size-fits-all approach. Modern cancer care is personalized, precise, and constantly evolving. Once a cancer diagnosis is made, one of the first questions patients ask is, what happens next? The answer depends largely on something called cancer staging. Staging describes how much cancer is present in the body and where it is located. Doctors assess the size of the tumor, whether cancer has spread to nearby lymph nodes, and whether it has reached other organs. Staging helps guide treatment decisions and provides important information about prognosis. Another key concept oncologists emphasize is that cancer is not a single disease, but a collection of more than 200 distinct diseases. Even within a single tumor, there may be multiple subtypes of cancer cells. This explains why treatment can shrink a tumor significantly, but not eliminate it completely. Some cancer cells may respond well to one therapy, while others may be resistant and require a different approach. There are 3 primary traditional treatments for cancer: surgery, radiation therapy, and chemotherapy. Surgery physically removes the tumor when possible. Radiation therapy uses high-energy rays to damage the DNA of cancer cells, preventing them from dividing. Chemotherapy uses drugs designed to kill rapidly dividing cells. While effective, these treatments can also affect healthy cells, which is why side effects occur. Oncologists are constantly balancing two goals: destroying as much cancer as possible while protecting healthy tissue. This balance is at the heart of cancer treatment planning. Over time, advances in medical science have allowed doctors to make treatments more targeted and more tolerable. Today's therapies are far more precise than those used even a decade ago. One of the most significant breakthroughs in modern oncology is the ability to analyze the genetic makeup of a tumor. This process, known as genomic profiling or molecular testing, allows doctors to identify specific mutations driving a patient's cancer. These genetic fingerprints can help guide treatment choices, allowing therapies to be matched to the biology of the tumor, rather than relying solely on its location in the body. This approach is part of what is called precision medicine. Precision medicine recognizes that cancer treatment works best when it is tailored to the individual. For many patients, this has opened the door to targeted therapies and immunotherapies that were not available in the past. These treatments can be more effective and sometimes less toxic than traditional chemotherapy. Another important message oncologists want patients to hear is that treating cancer is about more than killing cancer cells. A cancer diagnosis affects the entire person, physically, emotionally, and mentally. Fatigue, pain, anxiety, depression, and fear are common and real experiences. Addressing these symptoms is not optional. It is a vital part of effective cancer care. This is where integrative oncology comes into play. Integrative oncology combines conventional cancer treatments with supportive therapies such as nutrition counseling, physical activity guidance, stress reduction techniques, acupuncture, and psychological support. These approaches do not replace standard treatment, but they can significantly improve quality of life and help patients tolerate therapy better. Nutrition, in particular, is an area many cancer patients have questions about. Oncologists emphasize that there is no single anti-cancer diet, but evidence supports the importance of balanced nutrition. Adequate protein, fruits, vegetables, whole grains, and healthy fats support the immune system, help maintain strength, and aid recovery. Any dietary changes, including fasting or supplements, should always be discussed with the medical team to ensure safety. Patients often ask why cancer treatments sometimes stop working. The answer lies in cancer's ability to adapt. Cancer cells can evolve, developing resistance to therapies over time. This is not a failure on the part of the patient or the doctor. It is a biological reality. When this happens, oncologists adjust the treatment strategy, sometimes combining therapies or switching to new ones as research advances. Receiving a cancer diagnosis is undeniably frightening. However, oncologists want patients to know that this is one of the most promising periods in cancer research history. New treatments are being developed at an unprecedented pace. Therapies that did not exist a few years ago are now saving lives and extending survival for many patients. Equally important is communication. Oncologists encourage patients to ask questions, express concerns, and actively participate in decision-making. Understanding the goals of treatment, whether curative or focused on quality of life, helps patients feel more in control during a challenging time. Trust between patient and medical team is a cornerstone of effective care. Another message doctors emphasize is that no one should go through cancer alone. Support from family, friends, counselors, and patient communities can make a meaningful difference. Emotional well-being is not separate from physical health. The two are deeply connected. Managing stress and mental health can improve resilience and overall outcomes. For women, breast cancer deserves special attention because it is the most commonly diagnosed cancer worldwide. Advances in screening, early detection, and treatment have significantly improved survival rates. Many breast cancers are now highly treatable, especially when detected early. Understanding the biology of breast cancer, including hormone receptor status and genetic markers, has transformed how it is treated. Oncologists also stress the importance of realistic hope. Hope is not about denying difficulty or pretending cancer is easy. It is about recognizing that medicine continues to improve, that treatments are becoming more personalized, and that many people live long, meaningful lives during and after cancer treatment. Finally, oncologists want every cancer patient to know that they are more than their diagnosis. Cancer does not define a person's worth, strength, or future. Each patient's journey is unique, and progress is being made every single day in understanding and treating this disease. As science advances, the focus of oncology continues to shift toward treatments that are more precise, more compassionate, and more effective. Knowledge empowers patients to make informed choices, reduces fear, and builds trust in the process of care. Understanding cancer does not make it disappear, but it does make it less overwhelming. If you found this video helpful and want more science-based, calm, and trustworthy content about cancer, nutrition, treatments, and emotional support, please subscribe to the channel. We are committed to sharing real information, guided by experts, to support patients and their loved ones.